Hi, my name is Alexa Townsley, and I'm going to give you a quick background on capsule endoscopy through a PechaKucha format. Throughout this presentation, I'm going to inform the audience about what capsule endoscopy is, how it is helpful, what an individual can expect during the procedure, and I will describe post-procedure outcomes. Capsule endoscopy is a minimally invasive and painless procedure where the intestinal tract is examined through the use of pill-sized cameras. Other names for capsule endoscopy are capsule enteroscopy and wireless pill endoscopy. The easy-to-swallow capsule contains lights to illuminate the digestive system, a camera to take images, an antenna that sends the images to a recorder, all within a 1-inch pill, which is about the size of a vitamin. It helps doctors examine the small intestine, an area that is not easily reached with more traditional endoscopy procedures. During the capsule endoscopy, a person swallows a camera-like pill that passes naturally down the digestive tract, capturing thousands of color images that are transmitted to a recorder that you wear on a belt around your waist. The images saved on the recorder are transferred to a computer with special software that combines the images together to create a video. The pill takes about 30,000 pictures before passing naturally from the body, says Jonathan Darrow from Harvard Law Bill of Health blog. The images help to point out if there are issues and if further tests or treatment needs to be done. The procedure is completed after about 8 hours or when the pill naturally passes through the body. The pill is made so it can be flushed down the toilet. The battery life of the pill is about 10 hours, Darrow confirms. The images captured are able to be put on the internet to be analyzed by trained personnel anywhere in the world. Capsule endoscopy costs less than traditional methods used for this type of exam, ranging around $500 compared to the $800 to $4,000 other procedures of this type range from. A first-generation capsule endoscope was designed and tested nearly 10 years ago, with improvements being made ever since. Challenges involve designing the capsule to travel through the entire path while capturing images, meaning having a battery to last through the journey, enabling it to identify concerns, and creating a camera system that has maximum visibility. Size, speed, as well as camera view and quality are some of the advancements that were made. Authors Elikim and Adler, in their article Colon Pill Cam, Why Not Just Take the Pill, described the second-generation pill cam to have various new features like a data recorder with real-time viewer and the possibility to send screen messages. It's an easy-to-swallow pill that produces no pain or even sensation. Capsule endoscopy can be used to find the cause of gastrointestinal bleeding, diagnose inflammatory bowel diseases such as Crohn's disease, diagnose cancer, diagnose celiac disease, screen for polyps, act as a follow-up test after an imaging test, and aid as other helpful indicators. The article Understanding Capsule Endoscopy says the most common reason of the procedure is search for the cause of bleeding in the small intestine. Preparation for the capsule procedure requires patients to take the pill on an empty stomach, so having nothing to eat or drink for about 12 hours. It is suggested that individuals wait to drink clear liquids until about 2 hours after the procedure, and a light meal may be consumed after about 4 hours. Due to the possibility of medications interfering with the exam, patients are asked to stop or delay taking certain medicines until the procedure is complete or until the doctor follows up. Also, to prepare for the exam day, patients should plan to take it easy and avoid being overly active. Vigorous activity is to be avoided during the study, such as jumping or running, but individuals should be able to go about their day somewhat normal after the pill is swallowed. It is a semi-comfortable procedure compared to many, as patients are able to drive and go to work, depending on the job, after the pill is consumed. It is a generally safe procedure with little chance of complications. According to Darrow, from the Harvard Law Bill of Health blog, less than 1% of procedures conducted have complications. However, there is a possibility of the capsule getting stuck at a narrowed spot in the digestive tract due to inflammation, prior surgery, or tumor. Depending on the area where the capsule is stuck, it might need to be removed through surgery or through a traditional endoscopy procedure. Risks increase for those who may have a specific condition that causes the intestinal tract to be restricted. A doctor will most likely consult and give you a CT scan if the patient encounters abdominal pain or is at the risk of narrowing of the intestine. intestine. Although there are no complications in most cases, it is important to note the possible issues. After the procedure, the data recorder worn around the race is returned to the office so that images can be transmitted and examined. Failure to follow the directions may mean your capsule endoscopy may need to be rescheduled and done again. Mayo Clinic authors remind patients through the informative article on the topic. As mentioned previously, the procedure allows for images to be transmitted on the computer and later viewed by doctors from all over. Generally, test results are discussed around a week after examination. Capsule endoscopy is beneficial because it can help to identify complications before they progress. Widespread knowledge of capsule endoscopy could shift the use of more traditional procedures that are invasive and costly to less expensive and more comfortable options like swallowing a pill camera. General practitioners might be able to administer this option in the upcoming future as more studies are looking into this type of examination. Darrow from Harvard Law Bill of Health Journal describes in his article how advantages and effectiveness will only continue to improve over time. This exam proves to be continuously explored to make it comparable to other alternatives. Capsule endoscopy will become increasingly more popular as patients discover the benefits of this procedure compared to previous methods. Near the end of this slideshow, I have presented resources where I found my information on the topic, got helpful hints about it to know more inside information, and where I borrowed the images for all of the slides. Thank you for listening, and I hope you have learned some new information about capsule endoscopy and where it will go in the future. Thank you.